back. Okay, so we're talking a little bit about Bill C-14, which is essentially a law giving birth to legal, medically assisted medical assistance in death here in Canada. Minors, mature minors, are not, well, they really weren't included in this legislation whatsoever. So,
well, it says the person has to be over 18.
Over 18, yeah. Right? So, a 16, 17-year-old suffering from debilitating, painful, terminal conditions don't qualify?
That's right. And what's interesting is it has been won through the courts that what's called mature minors are young people who have a medical condition and can make a medical decision apart from their parents about treatments they will receive or not. And so in other jurisdictions in Europe, they have allowed mature minors, and it has to be very strictly supervised, but with debilitating illnesses, to apply for medical assistance in dying. And the one case that I had researched was a young fellow of 16 in the Netherlands that was granted medical assistance, but he had had numerous cancers and cancer surgeries since he was a newborn.
Wow.
And by the age of 16, he was saying, enough, enough.
Yeah.
And his parents were in support of him.
Yeah, I think at that stage it's the only compassionate thing that can be done, isn't it? People suffering from dementia.
Right.
Another bit of a gray area, it sounds like.
Well, the
where
law,
does it stand now?
The law is very clear. You have to be competent. And that's a sort of psychiatric medical term that says you know who you are, you're oriented to time and place.
You're making a cognitive
decision.
You're
making a cognitive decision.
Okay.
And so you have to be able to carry out a conversation about why you would want this. And one of the problems is that especially the baby boomer generation has seen so much dementia in their parents and also in friends.
Yeah.
And so what people want is the right, you can make an advance care directive that says, I don't want further medical intervention, or if I have pneumonia, I don't want to take antibiotics for that.
Sort of a preemptive...
A preemptive decision about how you want your end of life to be.
Okay.
But you can't say, if I begin to have dementia or lose mental capabilities, don't recognize my family anymore, can't feed myself, you can't do that designation and say, then I would want medical assistance in dying.
So you're essentially doomed.
With a cognitive impairment, you are. And so this is one of the problems too with people who apply for medical assistance in dying. The process takes, 3 or 4 weeks in the application. By the time you find the doctors to do the assessments, you have the grace period, and then you have the medications administered.
And the grace 10 days, of course. So we're talking better part of 1.5 months potentially.
Oh no, they're pretty hasty about getting the assessments.
Within a month,
I'd say
maybe?
Within a month.
Okay.
And but because a person is also on pain medication and medication to control their medical symptoms, that very often blocks their mental capacity.
Certainly.
So a number of people that have been approved for MAID may need, in fact, to reduce their pain medication so that they can stay conscious enough to make that clear consent at the last moment.
So they're forced to endure extra suffering in order to make that decision.
Because of the competency clause.
Well, that's a bit of a flaw, I would have to say.
It's going to be a big challenge, but the federal government has set up a council. It's called the Council of Canadian Academics that has 2 years to bring back recommendations on mature minors, those with primary diagnosis of mental illness, and this whole area of advanced consent.
Well, that's good. I mean, at least there's an effort being made to see where things can maybe go from here. That's good to hear. Now, current law states that psychological suffering would meet eligibility for physician-assisted death, but only with the caveat that death has become reasonably foreseeable. Those big gray area words again.
Yes.
That might be tough to prove that it's around the corner.
And it's psychological suffering.
Yeah.
But that is different than people who have had a chronic mental illness that they've been dealing with for 20, 30 years of their life and feel that life is no longer worth living, not in a suicidal way, but because there isn't the medical interventions for that mental health illness. Right now, they're clearly cannot apply for medical assistance in dying.
What's Dying with Dignity's position on those people?
We think they should be included. There probably would need to be a psychiatric as well as a medical assessment, but at least they should be able to enter into the process of finding out what could happen for them.
Is this being talked about, researched?
Well, it is one of those three things that this council...
It is included in the council.
Yeah.
Oh, good.
So they're
good.
going to be looking at that.
Oh, pardon me. You mentioned. Oh, that's good. That's good. Let's hope that goes the right way, because I think, frankly, to suffer for 30 years under those circumstances and not have the option available, it's got to be tough. Okay, so we kind of talked about where the bill is flawed or maybe missed a few steps. What did BC 14 get right?
Well, it got right that it was for irremediable illnesses. It got a uniform law across Canada. We're not like the states where every state by state is approved. So there's about 10 states now, and a number of states still refuse to acknowledge it. It did get right that people need to be covered by health care. So it means we can't have people come to Canada and apply for medical assistance in dying. Switzerland is the only country that allows that non-residents to apply. They got it right in most people can have it in their home if they're physically well enough to be at home, or in a facility. Where it didn't get right was that the provinces have been able to, because health is really a provincial jurisdiction, we have a patchwork across Canada of how this is being implemented. Alberta is really the leader by having one integrated way because of our integrated healthcare system. But in other provinces, you have to find the doctor that's willing to do your first assessment.
Okay, and this is another source of contention about the law itself. Doctors, nurse practitioners, they can opt out based on personal convictions. I mean, somebody's going to hear that and they say, well, you know what, that might be reasonable. If a practicing physician does not want to be responsible for a patient's death, then they can opt out, and I get it. Now, is the fear, though, that more and more physicians and nurse practitioners will opt out, reducing people's, I guess, window or different opportunities to end their lives prematurely? Well,
Dying with Dignity is really in favor and supports that medical practitioners
have the option.
Have that option, because that's a thing of conscience, just like conscientious objectors to going to war.
Sure.
But what has to be required is that those doctors and nurse practitioners that opt out should be mandated that they have to make an informed referral for the patient.
Yeah, certainly.
That is in place in several provinces, but in Ontario especially, there's a new group of Christian dentists and doctors who are mounting a court case to say that the physicians should not have to even refer a person to where they could get an assessment for medical assistance.
Which, to be clear, currently would be breaking the law.
Yes.
No?
Well, it's a gray area again. So there's started court action. But the biggest problem is that some institutions have taken it upon themselves to say that they are conscientious objectors.
So regardless of the personal beliefs of the physician and
or the patients, or the patients in that hospital. The institution, and the one big one is Covenant Health, which is a Roman Catholic administration of hospitals and hospices, has said they will not allow medical assistance in dying in their facilities, nor will they allow doctors to come in and assess the patient in the facility.
Okay, so people are going to hear that and maybe, well, why not just relocate from that facility to another facility? But is it that easy? If somebody's suffering where they can barely, I don't know.
Well, these are people who are usually bedridden. Yes, they have to be transported by ambulance. They have to be given increased medication to be transported. It's very stressful on the family. It's stressful on the health providers as well, because they've been caring for this patient and they feel badly that the patient has to be transported elsewhere.
Certainly, I can see that.
It's been very good. A number of long-term care facilities have started accepting those people that need to be transferred. And so again, Alberta has set up a process for this to happen, which other provinces don't have the same accessibility.
So we're doing a pretty good job here, it sounds
we
like.
are.
All in all, yeah. The government seems to take the position that palliative care is exclusive of medical assistance in death.
Yes.
What are your thoughts on that?
Well, and that's been very much the stand of the medical associations. I think it goes back to the fact that palliative care and hospices are only medical procedures that have been accepted in about the last 30 years. So these doctors had to fight for that being a medical way of treating and dealing with people at end of life.
Yeah, of course, yeah.
Not just giving every medical intervention possible until the person died.
Right.
So it's a new profession, and they really wanted to get a distinction between medical assistance in dying and comfort care until the person died. And so what's happened is we're starting to use a new term. We're calling it end-of-life care. So end-of-life care can include palliative care. It can include going to a hospice, which is a designated facility where you can go to die, and often has much, the medical procedures aren't implemented there. It's much more of a homey place to be. And then we also have medical assistance in dying. So we now, instead of glomming everything under palliative care, we've got this term end-of-life care that allows all those options. And that is supposed to be presented now to people when they have an incurable illness or a situation, that they should be able to talk about all three options to the medical people that are advising them.
At that stage in your life, the more options you have, probably better. I think that's only fair.
And it's about empowerment, about the patient being able to decide how they want to live their life in the last few days or months.
Yeah, absolutely. That just makes sense. Tell me a bit about, we're kind of pressed for time here, but Dying with Dignity's Shine a Light campaign.
Oh, yes. Yeah.
If you would,
Well, this was a campaign where Dying with Dignity has a map posted online under Shine a Light. And we have called all the different medical facilities and seniors' residences to see if they have set up a policy of how to handle it if a patient does request MAID, and what they will do if their facility doesn't allow MAID on premises. Will they transfer patients?
So you're kind of holding them to account.
Holding them to account,
right?
yes. And most of them were quite forthcoming with their information, and some weren't. But so more and more we're just posting that data online so patients and facilities can know where they stand compared to other facilities in the country.
The more you know, real quick, those who have loved ones that are suffering, or maybe suffering themselves, and want to learn more about medical assistance in dying, what's a good resource for them?
Okay, what they should go to is the AHS MAID care team. So, and you can do it as Alberta Health Services, Medical Assistance in Dying, and there's a very usable website. You can also phone 811, the health link number, and the nurses there will make the referral, like if people don't have a computer. We're not having the people contact the MAID navigators directly because there's only 3 of them for the whole province. So people can either do an online email in and say, this is my situation, and within 3 or 4 days, someone will get back to them by phone, or people can phone the 811. And then they can also contact Dying with Dignity Canada. We have a counselor there, Nino Sakopek, who's been with them for 5 years. So he knows the system in all of the provinces, because very often a family member here might be saying, but my parent lives in BC or in Quebec.
Makes sense. A lot of avenues available for people. Excellent.
And we do public education here in Calgary. We'll be having a big event June 17th.
June 17th.
That's
here in town.
Here in town to celebrate the first year anniversary.
Excellent. Good stuff. June, thanks so much. Thanks so much for joining us. I really appreciate it. It's great to meet you. Or pardon me, see you again. You've been here once before. Folks, that's all the time we have for tonight. Tune in next week. Of course, you can get at us. Don't be a stranger. We're on Twitter, Facebook, Instagram. Till then, take care.